Hi everyone, my name is Ruth Wilcock and I'm the Executive Director of the Ontario Brain Injury Association. I want to welcome you to our multimedia podcast series. The mission of OBIA is to enhance the lives of Ontarians living with the effects of acquired brain injury through education, awareness, and support. We are so excited to have partnered with Headsup Concussion Advocacy Network and the former Ontario Neurotrauma Foundation to publish this multimedia podcast series. I would now like to introduce to you Ryan Sutton, who is the Executive Director of Headsup Concussion Advocacy Network.
Hi, my name is Ryan Sutton. I'm the Executive Director of the Headsup Concussion Advocacy Network, a nonprofit organization whose mission is to challenge the stigma surrounding concussions. One of the most effective ways that we have found to spread awareness and education on this injury is to share the stories of people directly impacted by them. That is why my team and I are so excited to be collaborating with the Ontario Brain Injury Association and the former Ontario Neurotrauma Foundation to produce this multimedia podcast series.
I'd like to welcome everyone. My name is Leslie Birkett, and I'm an occupational therapist in private practice in Burlington, Ontario. And I'm also an adjunct assistant clinical professor in the McMaster University Occupational Therapy program. And I've been working in the field of brain injury for about 30 years. And I'm thrilled to be here discussing return to work following concussion or mild traumatic brain injury. I'm particularly pleased to be here with three individuals who have lived experience of concussion and return to work. And I'd like to ask each of them to please introduce themselves and also maybe to let us know how long they are post-concussion.
Hi, my name is Zoe. I am a student and I am currently on my 9th concussion, my most recent one being December of 2020.
3 months ago. Thanks.
Hi, my name's Mitch. I had my workplace injury, which was a concussion, about a little over a year and a half ago.
Hi, my name is Sophie, and my most recent injury was just under 2 years ago in May 2019.
So I wanted to begin by asking you all whether during the early phase of your injury, you received any education regards to concussion in terms of what to expect for symptoms and what to expect for the recovery process. And if you did receive any education, was that helpful to you?
So I did receive some education. I'm fortunate enough to have an aunt who is almost 6 years post, and she had gone through the whole process. So she kind of knew what I should and shouldn't be doing. But I also played lacrosse, so I have a background in sports, and I had heard quite a bit and have some knowledge of concussion. But I still feel the education's not, for lack of better words, it's not good enough. It's just, there needs to be more.
Yeah, so I'll say, I think generally, there's a lot of awareness around what to do potentially in the first couple of days post-injury. And then the information often peters off after that. It's very focused around sport as well. And, a lot of the information out there, even from good resources, will say 48 hours of rest and then kind of gradually return to activities and then leave you there. So I found that was a bit of a theme. And then, when you're left with lingering symptoms or struggling to return to school or work after that, it's harder to find resources. So I guess it depends what you define as an acute phase. But I mean, in medicine, we define that as generally less than 3 months or so. And certainly I don't think there's a lot of resources out there going beyond the first 48 hours to week.
Thank you. And Zoe, how about you? Do you have anything to add to that?
Yeah, I would agree with both of them. I think, like I said, I've had quite a few concussions. My first one was in 2012. And since then, it's pretty much been a yearly thing for me. And yeah, I think that there has been a lot of research more recently, but it's nowhere close to where it needs to be. I mean, I can even see it from my first concussion to now of how much the protocol has changed. You know, my first one, it was sit in a dark room until you don't have headaches anymore, so I was in my basement by myself for 6 months, sitting in the dark, which obviously nowadays no one would ever do.
I think you've raised a really good point. I think the recommendations change as the research advances, and certainly rest for, beyond 48 hours is no longer recommended. And to Sophie's point, I think there is a lot of information out there about, for the folks that get back pretty quickly. But we do know that approximately 15% of individuals who have concussion have persistent symptoms. And so then navigating what to do at that point becomes a lot more complex. For listeners who are in the early phase of their concussion, they can certainly look on the web at braininjuryguidelines.org, and there are a lot of patient resources on there, so that might be helpful. So I'm wondering now, each of you has a very different concussion journey, and I'm wondering if you can share sort of how long following your concussion experience did you start your return to work process?
Yeah, so I've actually had 3 workplace incidences in the past year and a half. All 3 of them happened to be at different jobs because I was a student. When I was working at a summer camp, when I was on my co-op, and my most recent one here. And they're all quite different stories. For my first one, I was working at a summer camp, and kind of a freak accident, a disco ball fell out of the ceiling and smoked me in the head. And for that one, it's so hard at a summer camp because I was in a higher up position and I didn't want to leave. So when I first got hit, I knew pretty instantly that this is going to be, if anything, a mild concussion. I didn't think it was that severe. But because I loved what I did so much, I actually didn't tell people right away until I noticed how much it was affecting me. And it also happened to be, I was the assistant for the program, and it happened to be the week that the director was gone. So that was also part of the reason I didn't want to tell anyone, because I was now in the higher position and there was no one to take my position. And I was at camp. So I took a day or 2 off, but then I pretty much stayed at camp and just played it off a little bit because I knew I would be okay, or I assumed I would. And I feel like in the moment, I don't always realize the after effects of a year later, 2 years later. If I had taken that time, how would my symptoms have changed now? And that was similar to my second my second workplace injury concussion. I was a live-in assistant in a home for adults with developmental disabilities. So I was living and working in the home. And I was in Edmonton. So I'm from Ontario, and I was doing my co-op in Edmonton and was far from home. I didn't really have my support system that I was used to around me. And so that one, again, I just kept working. I told them about it, and I would get 3 hours off a day. And on those 3 hours is when I would go to the physio. And then other than that, I was still doing my job. So for the first 2, I didn't really have time off, and I didn't take that time. And so for the most recent one, I feel like is the first one I've fully gone through the process of returning to work, of how it should be.
And I think your point about disclosing symptoms is an important one. And certainly we know with young people that not disclosing symptoms is a concern. So, hopefully people who are listening in recognize the importance of that, because what we want to avoid is aggravating or provoking your symptoms by return to activity too quickly. Sophie or Mitchell, did you want to add in terms of your return to work?
So I can share. I definitely had some prior experience with concussion, and as well had the fortune of working with Leslie as an OT. So I did definitely have some knowledge about the process. But despite this, it's so easy to still kid yourself into thinking, well, this time will be different, or this time I can just push through. So definitely initially I thought, okay, maybe I'll need a couple of months off. And then did start to go back in gradually, but it was a bit too quick, and then I pulled back. So I'd say, a couple of months in, I had started part-time, but ended up kind of dialing everything back to only about I should have looked. I'm trying to remember. Like, I think I was doing a couple of half days per week. By the time maybe Leslie remembers, but when I was coming back in the fall of 2019. And then I progressed quite well until I was working about half time by around March of 2020. And then I actually had an incident that happened again where I thought that I hit my head and kind of, that mental health piece for me was quite difficult. And I think almost anybody who's had a head injury feels some of that trauma response whenever they think that they may be close to hitting their head again, or when they've had that experience. So that kind of I had a setback basically at that point, and then really had to go kind of dial everything back. So then I had my second return to work this last summer, I guess by now. So in July 2021 or so. So coming up on, I guess, about 9 months instead, or however many months it's been. And then basically started again from about a couple of half days per week, and then gradually added on time until where I am, which, it's still a work in progress.
Thanks. And Mitchell, so how long after your concussion did you attempt to return to work?
So I have a kind of a similar story to Sophie, actually, where except my time frame is shorter. So when I had the initial accident, I had taken about 3 or 4 weeks off of work, and I went back to work, and I had a second accident. And then, like, since that second accident, I was like not sleeping well, horrible headaches. Like it forced me to basically really take a step back. And then about 9 months later, so March of 2020, I tried going back to work. I tried going back for about a month, and I was just like, this isn't working. I'm still really struggling to function without work, and adding work on top of it is making it very stressful and hard. So I took more time off, and like I said, I'm just in the process once again of trying to return to work.
I think this shows how complex returning to work is. And also, the three of you all have different timelines. So it certainly points out how individualized it is. And we know that we really need to pay attention to the symptoms, right? Treating the symptoms is the underlying thing we need to do so that we can manage at work. Did any of you receive any pressure to return to work? And if you did, how did that play out and affect you?
I think for me, most of the pressure, I was fortunate that most of the pressure was coming from myself. And I think that's quite common from a lot of people. Even if there's some external pressures, they have expectations of themselves. And if they're used to performing at a high level, or even just being busy in their day to day and enjoying that, it's really hard to accept and scale back. And you feel like you're failing, or, to admit that you need to scale back significantly. So yeah, I'd say most of that was internal for me. And then there were some external pressures in that. I think we're going to get into some of these details later about insurance and things, but even if there was a source of income that I was relatively sure would work out, there's still such a process to go through. So that is a barrier, I think, for a lot of people, because you not only have to admit, okay, I need to take a step back, I need to recover, and I'm going to need support and accommodation, but you also have to then fill out dozens of forms, and you're exhausted at the time, and you're in your acute recovery phase, and you're expected to kind of do all these applications and advocate for yourself. So it's really exhausting because you don't have the energy at the time to do that. So I think that's part of the system that's quite a barrier.
So pressure from yourself as well as from insurance, you thought. Yeah. Did either of the other two of you feel any pressure to return to work?
Yeah, I would agree with Sophie that most of the pressure was probably more internalized. Like working at a summer camp or in a group home for adults with developmental disabilities, and even my job now, I work one-on-one with an individual with disabilities that I think most of the pressure was feeling like I was disappointing them or letting them down because I couldn't do my job. And so that was a big stressor for me, or feeling like there's no one else that can take my position, even though I know all these organizations have other workers that are willing to step in. It's just more of a sense of like wanting to feel productive and purposeful. And when I took that chunk out of my life, you just feel like you don't have as much of a purpose. So it's hard to not put that pressure on yourself to go back to work.
Right, right. And Mitchell, you were going to add something?
Yeah, well, very much like the other two at the beginning, a lot of the pressure was coming from me. And like, I think in society we have this weird tendency to feel, well, anyways, I feel guilty for like, I was feeling guilty for getting workers' compensation and not working.
Right.
At the beginning. And so I was kind of like, I got to get back to work, and like, I just feel bad getting paid and not working. But then someone told me, they're like, that's the point of workers' comp, is to prevent these kind of things for people going back to work too quickly and hurting themselves again and making things exponentially worse, which is what happened to me. And then when things got really bad, I had to take a step back. But currently, they're the specialty clinic and the WSIB, certainly they're poking you to go back to work, and they're constantly trying to tell you you're good enough to go back to work, and like there's a certain amount that you have to push yourself to, and I understand that part of it. Like, you can't just sit in a dark room and do absolutely nothing. So I don't know, it's hard.
It is hard. And it's interesting that all three of you have pointed out that the pressure you put on yourselves was a significant factor. I wasn't expecting to hear that as much. I was expecting more to hear the other factors that you've identified. So that's I think a good message for people to hear, is that sometimes that internal pressure can be one of the worst enemies in the process initially anyway. And something you guys have also a few of you have mentioned, is the issue about having to scale back your work. You get to a certain amount of hours and having to pull back, and how hard that is on you. And certainly I know from my clinical experience, that's not uncommon. We see that, and that's, I try and warn people at the beginning, that's not to be unexpected. We learn from that and hopefully go forward, but it can be really disappointing, I think, at the time, because we want to see this linear march of progress, and that's not always the way it happens, unfortunately. And so I think moving forward, I think you've all briefly touched on this, but what I've heard, I believe, is that all of you, when you returned to work, were symptomatic at some level. So I'm seeing head shaking here for our audience. Yeah. And what were the most, from the symptom perspective, what were the biggest challenges in terms of return to work?
I think for me, it was hard to distinguish some of my symptoms in a way, just because I've had symptoms essentially since 2012. So to figure out whether this was like a symptom from my most recent concussion, or is this just the chronic pain I deal with daily that I can push through or not. Sorry, I kind of lost myself. But yeah, I think that was hard for me. And like, yeah, my biggest symptoms are headaches. And it's hard when you tell people that you have a headache when the majority of society gets headaches.
Right. Yeah, that's an excellent point, because people, headaches are a very common symptom in society at large. But many people after concussion talk about, increased frequency, increased intensity of headaches, and living with a headache on a day-to-day basis is a pretty awful thing.
Yeah, and I think for a while for me, it wasn't really a question of like, do I have symptoms right now, or like a yes or no. It was more of like, okay, what intensity are they at? If it's at like a 3 or 4, okay, I can probably push through it. 7 or 8, maybe I should go rest for a bit, kind of thing.
Right.
I would say that kind of monitoring energy expenditure is really hard, because at the beginning you're going back with limited reserves of energy, and then just finding that balance of pushing yourself like Zoe said, pushing yourself a little bit so that you know you're making progress without pushing yourself to the point where you'll experience a setback or not be able to, go the next day or do what you need to do that evening.
Mitchell, what for you was the most troubling symptom at your time when you returned to work?
Well, so at the beginning, like I had a headache that came on at the end of the day, and then when I had the second accident, at the very beginning, it was the insomnia. Like I went 3 days without sleeping, and it was horrible. And now my sleep has stabilized, so now it's the headaches that are the most troubling symptom, I guess, or the most disabling symptom.
One of the hardest things about recovering from a concussion or traumatic brain injury is the alienating feeling that can come with the invisible nature of these injuries. Often, people around us don't fully understand the struggles we deal with on a daily basis, or the challenges that can come from the unpredictable recovery process. Having support and empathy during this time is a crucial element of healing. And the Headsup Can Advocate program fosters a community that spreads awareness on the individualized nature of concussions and traumatic brain injuries by sharing unique stories of people who have experienced them directly. Our Advocate program has become an inspiring source of lived experience education and holistic understanding for those currently experiencing the injury and the people that support them. Join our growing community of advocates today by visiting www.headsupcan.ca/advocates and share your story to help further our mission of challenging the stigma surrounding concussions.
And now, back to the episode.
And so I think, one of the things that all of you have pointed out is that you have returned to work with some symptoms. And I do actually think that's an important point to get out because, the presence of symptoms in and of themselves is not a reason to not initiate return to work. But as Zoe mentioned, there's an issue around, how symptomatic you are. And that's the sort of knowing yourself piece. So if you're at a, sort of a baseline level of symptoms, then that would be okay. But if it's really pushing you into an elevated warning or, a warning level where your symptoms are starting to flare, that would be of concern. But it is important to know that people do return to work when they are symptomatic, because we do know certainly for individuals with prolonged symptoms, sometimes symptoms are very long term, and so that in itself is not a barrier to returning to work. And so, my next question is really what were the biggest barriers and challenges in your return to work process?
For me, it's the type of work that I do. Because I work cargo for an airline, you're working around airplanes, you're working around forklifts, and it was kind of, in my eyes, it was a fairly dangerous job to be doing as a fully aware, non-concussed person. And you put the type of environment that you go back to work, I think matters for concussion. Put them in a place where it's safe, and put them in a place where injury is not going to happen again, or the likelihood of an injury is not going to happen again.
How about Sophie or Zoe? What did you find?
So I think for me, it's just that kind of, it's so gradual. And this is something that anyone with persistent symptoms would relate to, is just that it's painfully gradual. It takes a long time. And if you rush it, you're going to have a setback, and it will take you even longer. And you have to kind of come to terms with that, which is challenging. But I certainly think that, I guess for me, most of the barriers were just the actual process of coming back. It wasn't necessarily that the kind of, I'm trying to think how to say this. I guess just when you come back into kind of a high pressure job situation, you expect yourself to just be right back where you left off. And so again, removing some of that internal pressure and giving yourself that time and space to come back and to gradually improve and see your symptoms improve, and then slowly be able to tolerate more and more. I think as much as those aren't really workplace barriers, though, that's the most difficult part. And it is a barrier that it can take so long, because sometimes you think like, well, everybody would have expected that I was already back or that I was already better. And some of those perceptions are difficult to deal with at times because, again, there's this perception out there that concussions are most of them resolve very quickly, which isn't the case for many people. And so just having others understand that, yes, I'm back at work. I need support and accommodations, but I'm not able to work. So I think it was difficult. I guess that's where I'm going with this. Is it was difficult to find some understanding in others where they think, well, kind of like what Mitchell said. Oh, you just need to relax. You just need to rest, and they'd almost tell you to just go do that. Whereas you're trying to explain, no, I'm actually trying to push myself and come back, but I'm still not 100%. And I'm on my way, but I need this kind of support and accommodation. And I think just disclosing that is difficult too, because often that's kept, it's optional to tell your workplace about why you've been off, and in many cases that's confidential. But then it's really hard when you're returning to work with something like a concussion or a brain injury of any kind. It's hard to actually get those accommodations put in place and to have others understand without them knowing what you're coming back for. Because otherwise they'll think that, I don't know, you had a back injury or you had surgery or something and it's a physical problem and you just need to sit while you do your job and that will fix everything, which is obviously not the case. So I think that understanding is a barrier.
I think you raised a couple of really good points, Sophie. And one of them is you mentioned about high pressure job. And I think that the world of work right now across the board is pretty high pressure. It involves a lot of multitasking, quick decision making. And I think, the way work is in our modern society in itself can be a barrier. And the other point that I wanted to loop back to that you mentioned, Sophie, was really what I think of a bit of the invisibility of the symptoms, right? Is that I think there's better knowledge about concussion and brain injury out there. But I think it's still a barrier because I would expect many of you have had comments that, oh, you look good, right? And so therefore that should mean that you're just back to how you were before. And we know that's not necessarily the case.
And not even just that you look good, but that actually you seem to be performing well and doing well. Like if others see you being successful at what you're doing, they might assume that you're feeling really well, which isn't always the case.
For sure. Zoe, before I loop to you, I'm just going to see Mitchell just wanted to add a little point, so I'm going to let him add his point, and then we'll hop over to you, Zoe.
Yeah, I just thought it was like, I don't know if it's considered a barrier, but like putting a time frame on your recovery, because then you start doing things too quickly, or you start pushing yourself too hard. And like, it's good to push, but when, insurance or people are the prognosis is that you should be better in a year and a half. And then that's the time where you're supposed to like do this X amount of things. I think that's kind of dangerous. So that, I think that's a bit of a barrier. And I was thinking that like goes into, one of Sophie's points. I can't remember exactly the context of what she was saying, but like, it made me think, yeah, like timeframes can be a bit dangerous.
Absolutely. Particularly if you have some expectations and you're setting for yourself that maybe aren't the most realistic, then that can be really hard. Zoe, can you add anything about barriers or challenges for return to work?
Yeah, I think they both hit on some really good points. Sorry, I'm trying to collect my thoughts. Yeah, I think kind of the whole like concussions are an invisible injury, and it's hard for people to see you succeed in one aspect of the job, but then still struggle with another. I know like even little comments from friends and stuff being like, oh, if I go play volleyball with them or whatever it is, and you're going for a walk, it's like, well, you can do this. Why can't you go back to work and do that kind of thing? And it's hard to find the line of being like, I can do some things, but not all things.
Right. You feel like you have to justify yourself, that sounds like.
Mm-hmm.
Yeah.
And then also like just jumping off that, certain parts of the recovery can take longer than others, and it isn't always logical to others. So like, for instance, my exercise tolerance, I had that, back to quite a high level much earlier than a lot of my cognitive work that I was still working on as far as like tolerating screen time and things like that. So yeah, exactly like Zoe said, just because I can go for a long bike ride doesn't mean that that I'm 100% back to being able to do several hours of screen time or multitasking or reading and learning in a day.
And that makes me wonder, and Sophie, I know the answer to this for you because we work together, but so Zoe or Mitchell, we'll start with you. Did you have any support or guidance to help you, plan your return to work?
Yeah, like I said, my first 2 work injuries, I kind of just didn't leave work. But this one, I'm now seeing a specialist to help. And so we've kind of gone through the whole process of WSIB and everything. And I'm a student, and because I couldn't really do any of the paperwork, luckily, like I was able to kind of call in and say, like, I give my mom permission to fill it out and talk to them for me. So she's been a huge advocate for me, which has been very helpful just because I couldn't think. I'd get these long emails with all these forms, and I'm like, I can't even like look at my computer. There's no way I can read all this and fill it out.
And Mitchell?
Yeah, I've had a tremendous amount of support. You're asking specifically for the return to work process, right?
Right. Yeah.
Yes. So in terms of returning to work, I've had a return to work specialist. Mm-hmm. I've had the specialty clinic. I've had family members like my aunt who's been through, she didn't actually end up returning to work, but she's helped guide me through some of the insurance issues that come up. And like Zoe, my mom has been thank God for my mom, because I don't know where I would be if I had to deal with put all the pressure of the insurance on my back and do all the paperwork, make all the countless hours of phone calls, trying to get them to do stuff for me. My mom has been there since the beginning, and so like I said, I don't know where I'd be without her. But yeah, basically that's a lot of the support I've had with the return to work process. Sometimes my parents will drive me to work if I'm not feeling the best, so yeah, I mean, I've had a lot of support.
Good. And Sophie, is there anything you want to share about support that you had for return to work?
Yeah, I feel pretty fortunate that I had Leslie to help me plan that return to work, certainly. And I had other supports in other areas as well, and definitely think family and friend support is important too. But it's to Zoe's point, and Mitchell as well, it is important to surround yourself with people who can help advocate for you, whether that is a clinician like an OT or whether it's a family member. And you have to do a lot of advocating for yourself regardless. But it is nice to also know that you have this person kind of backing you up. And especially if it's somebody like an occupational therapist or potentially somebody who's associated with your workplace. It's really nice if they kind of understand the system that you're working with and understand how to navigate that, because you have to think about your health, but then you also have to be kind of realistic about the landscape you find yourself in based on what workplace you're in. Oftentimes we, even if we think we know what's best for us, it's nice to have somebody as a sounding board to kind of confirm what we're thinking. I think oftentimes, people who are recovering from an injury, they'll think that something is, if you think that something's too much, it probably is. But then scaling that back takes a lot of work and there's a lot of nuance to it. So just having somebody that has expertise in that area that can guide you through it is extremely helpful.
And I think, the three of you are lucky that you've all had some really good support to help you navigate return to work, because it is very complex. Unfortunately, there's so many people out there who don't have access to services. And that would be such a huge challenge, I would think. I just want to remind people that, and I look at this with the people that I work with too, that you are the experts in your job. So you certainly bring something very valuable to the table. And Sophie talked about you also, if your sort of red flag is waving, saying this might be not a good idea, to really pay attention to that. And hopefully people who are listening in are learning that it's not necessarily a fast, linear process to return to work. And so hopefully that gives people some comfort. But there is some skill involved in trying to break things down and figure out what is a manageable starting point and then how to build from there. Certainly for many people who can't access, for example, workplace supports or rehabilitation services, family doctors are obviously great resources to talk to try and do some planning too. So, most people have access to a family doctor, and that would be a good place to turn to. And so that kind of leads me to the next thought, which is about accommodations. And we've heard that word come up a few times in the discussion already. So I'm wondering what people have found were the accommodations that were most helpful to them. And also, conversely, if there were accommodations they felt they needed, but they were denied.
I would say for me and my work, I think that most of my symptoms that I have now are more cognitive. And my work is more physical, I would say. So it's not as many accommodations that I need there, but it's school related. More so because I am still a student, especially now in these times with it being all online, it's pretty difficult for me to do. And so I'm off this semester just because I couldn't do school and be on my screen for 8 hours a day doing it. But yeah, I think school accommodations have been great. And for work, I haven't needed like a ton, besides just like lessening hours and, not picking up a bunch of heavy things and not doing a bunch of the like online forms that I have to fill out and I'm printing them off and kind of little things like that.
I'd say for me, I think the critical thing was just going back very gradually and then revisiting every couple of weeks or every month or however, whatever frequency you determine with your support person or your clinician is important. Because, and like Leslie said, knowing that the timelines can change and your goals for being up to a certain amount of hours by a certain point sometimes need to be altered. So I think just having that flexibility, which for many people might sound too idealistic because maybe your workplace wants it to be a bit more of a cookie cutter return. But I would say that that's kind of a critical accommodation, in my opinion, to have some flexibility and having your workplace know that you may have to scale back again. You may have to readjust and you'll have to be constantly reevaluating how you're doing at the next level that you reach. I think another thing that was really helpful for me was, looking at the week as a whole and thinking about the hours of the whole week. And, my job is quite varied. So just thinking about, I guess, the aspects of each task and maybe which days are going to have heavier screen time, which days are going to involve more reading, which days are going to be longer and building all of that in. So not just kind of, assigning hours to each task, but I think many people have many jobs within their job. So just taking that into account and determining which ones are going to be more challenging or maybe that you need to return to later. And potentially if you have a day where, once you're working up to full days, you have a day that's quite heavy for you, keeping that in mind and potentially not working the next morning or building in those breaks. And then with breaks, I think that's pretty critical too, just, building them into your day. It's difficult to do really explicitly, at least in my field, because again, it's hard to just take a break without disclosing why you're taking the break. But I do think it's really important to recognize when you need a break, not push yourself past that point, and make sure those are built in somehow, however that will work in your workplace.
And I think one other thing, Sophie, that came up with your work was the issue of shift work, which of course there's many different jobs. I imagine yours, Mitchell, too, also have shifts involved. And that is something that's pretty tricky to navigate early on. And usually we advocate that, the shifts come much later in the process, that you don't start your return to work with moving from days to afternoons to evenings, overnights, whatever it is, sort of thing.
Definitely, yeah.
Mm-hmm. And Mitchell, any accommodations that you can add that have been?
Fortunately for my job, I was able to wear earplugs and sunglasses, stuff like that. I was able to take breaks pretty frequently because I don't know, it's a warehouse. Like it's pretty relaxed job if But I wanted to add to a tremendous support for me was my union as well.
Good.
Yeah, because I think that's really important. A lot of people forget that if they're dealing with insurance, that to like make sure if they have a union to contact their union, because that's kind of the people that will give you resources and be supportive. So that was one thing I wanted to add. But in terms of accommodations, like I said, sunglasses, earplugs, and brakes are the biggest things for me.
And certainly lots of individuals who have sensitivity to light or sound use sunglasses or tinted glasses and earplugs.
Yeah.
They're pretty common. Yeah.
Whether you have sustained a concussion, a moderate to severe brain injury, or are a family member or friend to someone who has sustained a brain injury, we want you to know that you are not alone. OBIA is here to help. The OBIA helpline provides confidential, emotional support for anyone who needs a caring, compassionate, and non-judgmental listening ear. The helpline can also provide information about brain injury, advocacy, and make appropriate community referrals to callers. If you need help, please reach out today at 1-800-263-5404.
And now, back to the episode.
And one thing I wanted to mention is that, by law in Canada, an employer does have the duty to accommodate. They need to provide reasonable accommodations, and it's written in law to the point of undue hardship. So, there is legislation that protects workers, and I think that's important to know also.
And I think if I can just jump in with one more point there, Leslie, I think that it's important to stress to your workplace, and whether that's with the help of your advocate, that if you come back to work too quickly, it's likely going to take even longer. So I think, it's in the workplace's best interest to support you in coming back as gradually as you need to and with the accommodations you need. But sometimes they might not see it that way at the outset. So I think that's important to communicate as well.
Yeah, that's an excellent point. And just to sort of recap some of the accommodations, I think what we heard between the three of you are there's different types of accommodations. And some of the accommodations relate to time. So, the length of your shift or the timing of your shift. And I've had people do all kinds of things. If it's hard to get going in the morning, they, advocate to start working at 10 in the morning instead of at 8, for example. So that's one general category of accommodation. And then we also have duties. You can have accommodated duties where there are certain tasks that you might not do. You might have limitations on things like screen times. And one of the important concepts, which sort of goes back to something Mitchell was talking about earlier, is safety. So sometimes when someone's returning to work, we really need to consider, are there tasks that are not safe? And then that should be prohibited for the worker until it's determined that they are safe to do so. So, things we see are, for example, ladders. If somebody has any residual balance issue, that would be something that obviously would be a safety concern. The person should not be on a ladder of any way, shape, or form. So those are sort of general categories to think about when we're thinking about planning return to work. So now a few of you, I think actually it was Mitchell who mentioned that your coworkers were aware of things and they were supportive, and which is fantastic. And I'm wondering, Zoe and Sophie, if you have any comments about coworkers and how that sort of helped or hindered your return to work.
Yeah, I think for me, it's kind of different at each place. Again, with a concussion, we've said before, is being an invisible injury, it's kind of hard for people to wrap their heads around. And I think even little comments that they may not realize are that bad, of just even little things of like the amount of times I've heard like, oh, you look fine, or I get a headache too. Like, why is it so different? Those kind of take a toll on you after a while of feeling like, yeah, I guess if they get a headache too, why can't I just return how I want to? Even society these days have kind of been like, being busy is kind of how we determine success, and having to take that step back, and coworkers not fully understanding why when you look okay.
Yeah, I'd say I've been quite fortunate to have a lot of colleagues and friends in the workplace who've been very supportive. But I'd agree that it's hard when people don't quite understand, but I think it's important to tell people what you need, and to explain how they can support you, because a lot of people want to support you and they just don't know how.
Yeah, and I wanted to add, so, Zoe, you talked about headaches, right? And people say, oh, I get headaches. I think another symptom that is so prevalent in concussion is fatigue. And, similar to headaches, people say, well, I get tired. And it's really difficult, I think, to try and explain the differences with the fatigue that you feel following a concussion or a brain injury. And so I think that is one that I've heard over the years people struggle with, explaining that when they feel they need to, because Sophie mentioned earlier that, there's no onus on you to disclose specific things. But, when we're building return to work and someone has a limited tolerance for work activities, but maybe, as we've heard people say, might be able to go bike or play volleyball, it's, a lack of understanding about the fatigue and the cognitive fatigue that's experienced after concussion. So from the thinking, the problem solving, the screens, how those affect people. I think those are really difficult symptoms to explain to people who don't have the lived experience. And Michelle, were you going to add anything?
Yeah, neural fatigue is a lot different than like general fatigue.
Sure.
Yeah.
Yeah. How would you describe it? How would you say it's different?
I don't know. It's weird to say that I can tell when my brain is getting tired. It's just like, it starts making more mistakes. I start like being more klutzy and dropping things. And like, yeah, it's weird. It's like, usually most people's brains like have enough energy to do a lot of multitasking and do a lot of, a lot of different eye movements and stuff. And like, you can just watch someone with a concussion and watch their brain like become more tired and tired and tired. And they start, like I said, making more mistakes, like movement mistakes, or like for me, for example, I get scared driving, because if I'm driving and my brain starts getting tired and like, I don't want to look left, and then I could cause an accident. You know what I mean? So yeah, that's kind of the way I would describe it.
I often sometimes do a battery analogy where, prior to concussion, overnight your battery gets really fully recharged. But after concussion, that battery is never fully charged and it drains a lot faster. And so you sort of almost always feel like you're playing catch up. And that's a difficult position to be in for sure.
And it's hard to, when your tendency is to compare yourself to your fully charged battery.
Right. That's a learning curve, isn't it?
Mm-hmm.
For sure. So I'm wondering, for each of you, if you can share what you think is your best strategy for trying to prevent burnout and during the return to work process, and also to prevent provocation or exacerbation of your symptoms.
So I think I'm going to be a bit of a broken record here, but if something feels like it's too much, it probably is. And you have to, it is a learning curve to get to know yourself and your limits. And then just, realizing that the harder, especially with persistent symptoms, if we're talking about that as a theme here, especially with, in that scenario, if you push yourself too hard, too fast, you're going to take longer, you're going to have more setbacks. So just kind of recognizing that. And then I think also in that theme, just celebrating and recognizing your small milestones, which can be really hard, but, looking at how far you've come, even in very small ways, is helpful, because if you're just looking at that finish line and thinking how far you have to go, it's not very useful, because like Leslie said, it's not a linear process. So you can't exactly measure how long it's going to take you to get there, or what the journey will look like. But you do know kind of where you've been and progress you've made, however small. So you can focus more on that. And I think taking an approach that's kind of mindful and in the moment, which is really hard when you're suffering with symptoms, but rather than projecting so far out, kind of just trying to take things day by day and focusing on what your goals are for that day. And just trying to achieve those small goals can keep you motivated. And then I think as far as burnout, mental health is extremely important to manage. It's a really difficult thing to go through an injury, whether it's, less prolonged or very prolonged process. So just doing what keeps you well, whether that's exercise or, being with friends and family, and then also just making sure you get mental health support if you need it, and partly to process what's happened. I think Mitchell spoke about having regret that the incident occurred, and that's something I definitely dealt with. Like, it's almost like a grief that you go through, especially if you've been there before and it's not your first injury. You really beat yourself up or think that you could have prevented it somehow, no matter what the circumstance. So I think processing a lot of that is important as well. And then recognizing what parts of your mental health actually are integral to your symptoms. So if your mood and your anxiety, maybe even just with returning to work, recognizing kind of where you're at and checking in frequently with yourself to make sure that you're managing that and it's not exacerbating your symptoms or causing a flare or causing burnout.
I think that's a really good point. We talk about the vicious cycle of prolonged symptoms where you can have a headache, and then that causes you to have difficulty thinking and processing, and then that stresses you out, and that causes increased muscle tension, and you go around and around this vicious cycle. So I think, Sophie, you really touched on that well. Zoe or Mitchell, what would you share?
Well, it's funny because like Sophie's talking a lot about to paraphrase, a lot of self-compassion. Like meeting yourself where you're at, and it's like it's okay to be where you're at. Like society judges you a lot based on what your job is and how successful you are. And you know what, like Sophie was saying, you are successful. Like the milestones that you make, even though they're small, they're like, what you're going through is really hard, man. Like, you know what I mean? So having a lot of self-compassion and acceptance for where you're at, I think that can go a long way. Something I've been doing a lot is some meditation. I find that helps. Just checking in with my body and like seeing how it's doing today, that whole mindfulness and being in the present is really important for not burning out.
I love that. Thank you for that. I think the self-compassion and definitely we know there's a lot of research that supports the mindfulness and meditation in terms of the positive effects for healing. So that's great. And Zoe, did you have anything to add?
Yeah, I feel like they covered most of it. Even though a concussion is a physical injury, I think that there's a lot of other healing that has to go on mentally, physically, and emotionally. And just, checking in where you're at and doing other things to help your overall health. And taking those small wins. I know that was a big deal for me at first. I was a high level athlete, so it's hard when like my big win is like, oh, I can walk 15 minutes today instead of 10 minutes. But just like, just having that self-compassion and taking those small wins and taking it day by day. And knowing that, knowing even though you may be good one day, the next day you may have a bad day, but then you'll get back to where you were.
That's great. Yeah, thank you. And I think, sort of looping in with what all three of you have said, I always talk about that you can't use all your energy for work. That's not sustainable. And it's important to keep that in mind. And it's really important to have time, as you guys have all pointed out, for fun and time for connection with others. Those are such important things. And I think it's critical to healing, but also to living life. None of us can spend all of our energy just getting up and getting to work and getting home. That's not going to last over time. So remembering what's important is pretty critical. So just wondering if anyone has any final tips for the audience, because we're here today talking about return to work. And we know that work does offer many health benefits. It offers individuals a sense of well-being. So I'm wondering what final thoughts our three individuals with lived experience might wish to share.
I think for me, a lot of my coworkers and stuff happen to be like obviously around my age. I'm a student, and in the work environments I was in, I think sometimes when people think you have a concussion and know that you can't do a lot of things, they won't invite you out to do things, which can be hard too with your mental health. So I don't know. One of my biggest things that I tell my friends sometimes is that just because you're expecting my answer to be no doesn't mean that I still don't want to be invited out to do things.
Yeah, it's important to feel wanted. And kind of on Zoe's point too, it's I think it's important to surround yourself with people who believe you and who are willing to meet you where you're at. So if you need accommodations or you need to be in a less bright room, or, you be around people who are willing to make your life a little bit less stressful and easier, because that will be tremendously helpful, I think.
I would say the other thing that I would want people to remember is that when you're coming back, especially if you're having persistent symptoms, you may, especially if you're at all a perfectionist or a very kind of type A personality, you may be comparing yourself to your pre-injury self or your past self a lot. And our brains will kind of skew this, and you'll almost think that your past self was some kind of superhuman, do a million things at once and was never tired and always felt amazing. And that's just not the case. Everybody does feel tired sometimes. And even if it's not neurofatigue, pre-injury, we all had bad days. We all forgot things sometimes or made mistakes. And I think it's just important to not try to compare yourself to this idealized version of who you were before. And that's kind of with Mitchell's point of meeting yourself where you're at. And if you're just trying to constantly compare yourself to who you used to be, it just can be quite demoralizing and not motivating. And it's good to have hope that you will get back to feeling like your old self, but just don't let that be a constant comparator, and kind of more take things day by day and looking at what can I achieve today that I didn't achieve yesterday.
That's great.
I saw a great quote. It was, instead of trying to become the person you were before, focus on the person that you're becoming.
Well, that's lovely. That is the perfect ending. So I'd really like to thank Mitchell and Sophie and Zoe for being so open and for sharing their experiences about returning to work following concussion or mild traumatic brain injury. The next podcast will be a discussion regarding return to sport following concussion or traumatic brain injury, and that will be facilitated by Connor Massimo, who's a physiotherapist and co-founder of Pulse Physiotherapy in Peterborough, Ontario. Thanks very much.